And so stress is like killing us. So just like a minute of silence, if you close your eyes with me, humor me. You can put your hand over your belly or your hand over your heart. You could cross your hands, maybe where you feel your heartbeat between your fingers. That's a great way to calm down a little bit. And just be grateful for that last breath that you just took. I'm so grateful for that. And for the beating of my heart that I feel right now. For the community of people that we're growing. For the fact that we are not alone, that we're all in this together. For the bed that I sleep in and the roof over my head. And the meal that I had today. Thank you. Thank you guys for doing that with me. So, real important basic foundational understanding of everything that I do. And one of the reasons I start every talk that I give with a little bit of peace and rest, hopefully, is that there are only two causes for all disease. It doesn't matter if the name of your disease is arthritis, cancer, or autism, or hip pain, neck pain, osteoporosis, any inflammatory condition, any degenerative condition, and every genetic condition. Same two causes for all disease, okay? And this empowers you. So this framework I use for every patient that I see. And you have the power. So I try to empower people to heal themselves, right? So two causes, deficiency and toxicity. Deficiency is everything you need that you don't have. And toxicity is everything you have that you don't need. So all I do all day is figure out what I need to remove and what I need to replace. And that's true of all of these issues that we're interested in. It's also the prevention. So people who are well, who are just curious about what might happen in the future, the prevention is the cure. So when you give your body what it needs and you remove what it doesn't, you provide longevity, vitality, right? All these things. So that's how I think about every condition. And it's really helpful for people to get that deep in their mind and their spirit, because deep down often we know what we need to do, but we choose not to do it. And so I always have infinite hope because I've seen things get better that are not supposed to get better. And each of you live inside a magical healing machine that the Creator made, that is created to heal. So when we get it right, vision comes back, inflammation goes away, infection goes away, function comes back, pain goes away when we get it right. Okay, so really important foundation. Stem cells is a big topic. Broadly, okay, I talk with my hands a lot because it's helpful to get a framework. Broadly, there are stem cell activation therapies and then stem cell therapies where we give you stem cells or some product that people call stem cells. So stem cell activation therapies are very effective, and some of them are super cheap, right? So fasting, just not eating, activates your own stem cells. Cold therapy, okay? There are some nutrients like turmeric and some others, some special blends of herbs that can really help activate your stem cells. And I use both of these liberally because some patients have been sick for so long that you have to throw a big book at people, right? Um, but broadly, stem cell activation therapies, which I'll spend a little bit of time talking about, and then the stem cell therapy where we're giving you something. Okay. Inside this category, there are two broad categories: your own stem cells, and then donor cells or donor biologic products. Okay. So I am doing lots of different stem cell research. One of my major focuses is with your own stem cells. And your own stem cells come from two sources: bone marrow and fat. I don't do bone marrow anymore. The risk is too high. It's a big trocar into your hip, a huge metal spike into your hip. I don't recommend that anymore because we get really good results with the fat extraction. And it's a tiny little cannula that I extract fat either from your hips here, your backside, or right underneath your belly button. And I've done that in very skinny people. So I extracted all three of my kids, my whole family. Um, my middle son was probably the skinniest person I ever did. He was like 6% body fat or something, so didn't have any fat on him. And everybody has enough fat for us to get. Tiny little 2 millimeter incision. You don't use stitches. Local anesthesia. We pull out about 30 cc's of your fat, and then we send that to the lab, and they bank your stem cells after they purify them. And you have a forever bank of your cells. So you only do that procedure once as long as we get enough cells on that. I've never had to repeat the procedure. I have had to repeat it for a couple of other doctors that apparently weren't doing it right. I'm not sure. I've only done that twice for patients who had it done elsewhere, but it's a one-time procedure. You bank your cells, you have them forever. I do recommend that for anybody who can afford it because the benefits of that therapy are still being determined. So I banked my kids' cells because they're in sports and the traumatic brain injury, spinal cord injury risk is pretty high. And I can tell you they would have their stem cells the very next day if they had a devastating or a catastrophic injury. So it's a very safe procedure. It's a reputable company based in Houston, Texas, and we bank those cells and you have them forever. Once you have your bank, then we can do therapies with those cells. And that's a live cell where the benefit to a live cell is those cells they're called pluripotent cells. So they can become many different kinds of tissue. So those cells, when I inject them somewhere, can become bone and cartilage and nerve mainly. Those are the three big types that they can convert into. We don't have great evidence to say that they do that. We have a little bit of evidence saying that they do change into those tissues. But we have a lot of evidence saying that those cells assist the tissue that's there in creating new tissue. So it's still not clear whether those cells become new tissue. I know that they can because that does happen in the lab. But I did that procedure for my kids. I use them as an example just because, your own tissue is a unique kind of tissue. Your own cells are you, even though they're in the lab, right? When they do a bank. And that's quite a bit different from all of the donor products. So there is a benefit to having your own tissue, particularly for nerve injury. So brain injury, peripheral nerve injury, spinal cord injury, and that's not just a traumatic injury, also like a medical injury, right? So if you had a nerve damage or a brain damage from any sort of issue, like stroke, for instance, there is some probably additional benefit to having your own cells in a bank that you can give. once we create your bank, and I have patients that I've done for many years, we take that bank, we take those cells out, we thaw them, we grow the cells in a culture media, and you can convert infinite numbers of stem cells. So when you do that extraction procedure, you might get 250,000 stem cells if you're lucky. There are some orthopedic surgeons, there are some other types of doctors that will do what's called a same-day autologous stem cell transplant, where they take you in one day, they do the extraction from your bone marrow or your fat, they purify the cell, and then they give it back to you the same day. They might give you 250. If you're super lucky and you're young, you might get 500,000 cells. From the banked culture expanded cells, we can get 400 million, 800 million cells, a billion cells, because we culture expand them in media. And the dose does make a difference. So I have, for instance, I have a patient that had ulcerative colitis, a young kid, teenage kid, who got, nothing was helping. Medicine's not helping, nothing, right? Just getting worse. Bloody diarrhea daily, like wasting away from bloody diarrhea. 200 million stem cells didn't help him. 400 million cells didn't help him. 800 million cells, and he's been in remission for several years. So the dose matters, because the power of the cell is both what the individual cell can do and also what the community of cells can do. Does that make sense? Okay, so we have your own cells. Fat is my preferred cells, the only ones I do here. I don't recommend the same day procedures. So when somebody gets an extraction done and they get all those cells and you do that therapy that day, I don't do that here, because for the last 5 years or so, the benefit of that procedure has been gradually decreasing. And there's a lot of reasons for why that is, but I think it's primarily just a power. I don't think the cells have the power to do what we want them to do, because of a few things I'm going to talk about in a minute. But our food is messed up, our air is messed up, our water is messed up. We are in a swimming pool of toxins. The food is a really, really scary situation, and it's making people sick. And so the stem cells are just having a hard time when there's not very many of them. Okay. So I don't recommend those procedures. I think if you're going to do that type of therapy, you just want to get a donor product, because you're going to get more benefit from someone else's cells at that low dose than using your own cells at a low dose. Okay. So again, broadly, go back to the framework. We have donor cells and your own cells, right? Where you bank those and then you come back for therapy, bank them once, and you can do that therapy as often as you need. And I do some patients 3-4 times a year. My kids, 2 of my kids, I haven't treated them. I just banked them. And one child had a couple of injuries that I used cells on. So you can bank them and never use them, and only use them later if you need it. And you can use them as often as you want. So why would you want to do that? So the benefit of the live cell is it is sensing the environment and it's responding to the environment. So when I take a stem cell that's live and I put it in your body, it sort of senses what's going on. Is there too much inflammation? Is the immune system dysregulated? What's happening here? And then it releases things that can be healing. And the primary ways that it works are immune system regulation and decreasing inflammation. Those are the 2 primary ways that these cells work. So great results with autoimmune conditions. So rheumatoid arthritis, multiple sclerosis, those patients get pretty good results consistently, because the stem cells sense the environment, there's inflammation going on, there's immune system dysregulation, and they correct those. Okay, does that make sense? Multiple mechanisms where the stem cell is working. It is really important for the live cell. I think that's the best type of therapy with certain different types of injuries because of that sensing response, right? So for your own stem cells, that's the only thing we can do is a live cell. And we want as many live cells as we can get as often as we need them to do the job that we're trying to do, okay? That's your autologous. Then you have donor products. So donor products are typically birth tissues. We don't use any embryonic or fetal stem cells in this country. Those are unethical and illegal. Anybody who's advertising stem cell therapy is not using those types of therapies. They do use those overseas. So in Thailand, in South America, in Panama and Central America, we use those. That's a totally different story, which knowing your source is really key because it's the Wild West. And I have experienced this firsthand. I would never, ever go anywhere to get stem cell therapy in the US or outside of the US unless I knew the person personally and trusted the person that was giving me the cells. Because I have had suppliers that before I use a product, I go to the lab and see the tissue and talk to the chief scientific officer and the chief executive officer and the lab technicians and everything, because I want to know exactly where the cells are coming from. And the sad part is some of the CEOs of these companies that are selling stem cells, they don't know where their cells are coming from. And I don't know which is worse, not knowing where the cell's coming from or lying about it. But they do both. And I have had CEOs look me in the face and tell me a story that's not true that I verify. These are well-respected people in the industry. And it is the Wild West. So I don't buy anything from anybody that I have not personally seen their work in the lab. And there aren't very many people who do that because salesmen come to the clinics of lots of people doing this, and they're giving out product and they're giving special deals on product, and it's a little bit crazy. So we're on donor side, right? Where do these tissues come from? They're usually from donated birth tissues. So amniotic fluid, umbilical cord are the two most common. And what they do is those moms consent to donate their tissue when they fill out a lot of paperwork and they screen them for every single thing. These are safe products as long as they're done by an honorable person. And then it's all verified. But those birth tissues have lots of stem cells in them, lots of healthy young stem cells. And so you can extract the live cell and you can extract some of the other tissue. So Wharton's jelly is commonly used for arthritis. We inject it directly into the joints. And what that is the part of the umbilical cord that's not a cell, but that's between the cells, is like this matrix of healthy tissue. So it can help neck and back and hip and knee, all joints, replenish the tissue in there that we want to grow back, right? Or just to get healthier. And so amniotic fluid and umbilical cord are the two most common types that are used widely. You can get stem cells from anywhere. So for instance, if you were to go to Panama, there's a couple of clinics that are honorable there, but there are a lot that are probably using menstrual blood stem cells, okay, urinary stem cells. You can get lots of stem cells from these tissues, from the blood. from the bone marrow. Sourcing is really, really important because you don't want to inject anything in your body that you don't know where it's from and that somebody that knows what they're doing hasn't verified that it's safe. So that's really, really important because there have been some bad outcomes, right? Some really bad outcomes. So you want to be cautious if you're looking at other places. Okay, so your own stem cells, donor products. Donor products, we have live cell, and then we have not live cell. In the not live cell, we have a couple of different things. Supportive tissue and then exosomes. So the biggest rage right now is exosomes. What that is when you have a live cell, it releases these factors that are very healing. And how it releases these factors is through exosomes. They're little packets of information. So one of the ways that the commercial companies get these products is they take the Wharton's jelly stem cells, they extract them, they put them in a culture media, and they grow them, and then they catch the little products that they're releasing. And those little products are healing, regenerative signaling molecules that basically say, turn off inflammation, begin the healing process, regulate the immune system, a bunch of other things. There are hundreds of different products in the different signaling molecules in those products, and they're a little different across the product, but basically they're just healing signaling molecules, right? But it's not a live cell. And so the difference between live cell and not live cell is mainly this. The live cell can sense the environment and do something about it. The non-live cell, it is what it is. It is a message that I choose, whoever the provider is, chooses what they want to do. And these things work quicker. So I use high doses of these things. Best example of these exosome therapies and non-live cell therapies are for patients who, I used it once in a really, really sick, two really, really sick patients. One person dying of acute organ rejection. So they had an organ transplant and they were rejecting that organ and they were going to die from this organ dying. And nothing was working in the hospital. And came and saw me, and we gave her lots of those exosomes and turned off the organ rejection process and saved her organ. High doses, okay? Acutely, so COVID, a patient who's really sick from COVID, lung, dying, bilateral pneumonias on oxygen, nothing making them better. These products are very healing. You use high doses of them and they help calm down the inflammation from that acute lung injury, right? Stem cells work a little bit longer. The live cell is over 4 to 6 months where it's working. It's not going to do anything right away. If I give you a big dose of stem cells, typically that benefit is going to come in weeks to months as opposed to hours to days. So somebody that has a really bad inflammatory condition, I will do the exosomes at a high dose. And then to prevent the complications of that inflammatory condition, I'll use stem cells to keep the benefit going later. Does that make sense? So the benefit from, we don't know because the research is still being done. I have had patients who notice, this gets to the back to the frameworks. That's a good question. As long as you get to the underlying root cause of the problem, these therapies are very effective. So, a single good dose of something, when it's done in the context of a comprehensive plan, where we're figuring out what's needed to be replaced and what needs to be removed, they can be very effective. And the opposite is also true. So I've had a handful, I can count on 2 hands the treatment failures that I've had when we're really good and aggressive about thinking about why somebody's sick. And sometimes I know why that's not getting better. I'll give you a couple examples. If you're doing something daily that's creating an inflammatory response that we know is creating that inflammatory response, I'll give you a couple of examples. If somebody's sensitive to gluten, so a celiac patient, right, an undiagnosed celiac patient, which there are many, that continues to eat meat products that have gluten, sometimes that inflammatory trigger is too much to be overcome by anything. Okay, I had another patient who ran 70 miles per week. She owned a running store. She had bone on bone in her knee, and she would not stop running 70 miles per week. And I told her, this is not going to work if you keep running 70 miles a week, because our knees were not created to run 70 miles per week. And you have to change your goals, or you have to change your expectations. If you want to not have knee pain, you must stop running 70 miles a week, right? If you want to run 70 miles per week, you have to expect that you're going to have knee pain. The same thing with people who eat the food. When I say the food is messed up, there's nothing wrong with meat. Like, meat is a healthful food, but what's been done to it with GMO modification, hybridization, and covering it in chemicals makes it so inflammatory that our guts are messed up and our immune system learns what to do in our gut, and that creates celiac disease. It's not the wheat that's evil, it's the chemicals and the hybridization of the GMO that interacts with our immune system that creates inflammation. I've had lots of super athletes who have some injury, shoulder injury, hip injury, knee injury, and that it never heals. And it's because of their food that they're eating, because of their gut health. And no amount of addressing the shoulder will fix the shoulder if the reason why the shoulder is hurting is the intestine. So we always work on the intestine. We always start with food. I mean, I will do stem cell therapy on anybody, but this is the reason I want people to have talks like this, because it's fun to do injections, but what's really fun is to have somebody's problem go away. And so when I heal the gut and the shoulder, everybody's really, really happy. So now, sometimes we have, like, my mom's case, I've told her for how many years I've told her to stop eating corn. So corn is a really interesting thing. It's a helpful food when it's processed correctly, grown correctly, traditionally processed. But nowadays, all the corn is GMO. It's covered in glyphosate and mold toxin, and another chemical to kill the mold, even organic corn. And so these corn products, corn chips, corn tortillas, all of them are often really causing immune dysregulated disease because of the gut. Now, your knee got better for years despite eating corn every day. Yeah. So sometimes good things happen even when we don't listen to the doctor, but I don't. But it's still, I always need to tell people the best success comes when we do as much as we can to remove those inflammatory triggers, heal the things that need to be healed using basic, good process medicine. And the stem cells really help in addition. So let me make sure I covered everything I wanted to. Two broad categories: stem cell activation therapies and giving stem cells. So one of the things I did with mom was ozone injections. So every person that I do stem cell therapy on, unless they just refuse, I do at least one oxygen ozone injection, because it makes the stem cells work so much better. I have, at the beginning of my stem cell research, I had several patients who had spent $100,000 on stem cells and didn't get better. And there's several reasons for that. One of the reasons is chronic low-grade infection in the joint. So in the neck, and there are several published papers that show antibiotics for arthritis sometimes make arthritis better. And everybody's always assumed that that's because there's some anti-inflammatory action of the antibiotic that we just didn't know about. But I personally have good evidence to believe there's a chronic low-grade infection. Oxygen ozone treats that very well, very safely, very inexpensively. So my typical process is at least one oxygen ozone peptide injection because the oxygen is so safe and inexpensive. And peptides are other natural biologic molecules that are not live cells, also safe, very effective, and inexpensive. And then we do the stem cell. And so my patients that, you know, I got the failure rate from 15% sort of nationally down to less than 3% if I do it that way, where I get good success with just about everybody that I'm seeing. And so those are stem cell activation therapies. Oxygen, peptides, fasting, cold therapy, some nutrients. And there's one project I've been working on for many years that's really exciting. I'm almost done with it. But some stem cell activators that you can use orally and topically that really help those stem cells in your joints, including neck and back and hip, to regrow cartilage, or at least to, you sometimes can't see the cartilage on imaging, but if someone's pain goes away and they're bone on bone, we believe there's a thin layer, even just one cell thick, because if I just get one cell, it can really make that joint work better. So stem cell activation, stem cells, on your own stem cells, which you can bank and use, donor products, which you can use. Donor products are live cells and exosomes. The exosomes are more rapidly acting. The stem cells are longer acting. Okay. We didn't spend a lot of time on tissue. So some joints particularly really need the tissue. So it's like the Wharton's jelly matrix, which is just the stuff that is made up in the joint. And then we have the applications for general conditions. So using them, for instance, IV or intramuscular for systemic inflammation, systemic autoimmune conditions, Parkinson's, multiple sclerosis, dementia, all these things are mediated by immune dysregulation, inflammation, right? Always in a foundation of how do I replace the nutrition, right? Because the solution, the prevention and the cure is deep nourishment, nourishing my body with what it needs, and detoxification, removing what it doesn't need. Sometimes we have to do high-level stuff to figure out if there's an infection there that we have to treat with antibiotics or with other things. Or in a joint, for instance, we can do multiple ozone injections that treats chronic infection, and that helps get rid of those infections, and then we can heal the joint with the stem cell. So I think that's good, the broad overview. Why don't we take some questions? Does anybody have any specific questions? Okay, great. So the question is, how do we cleanse when we extract the fat? How do we get just the stem cells out? So that's the magic that's done in the lab. So we take the fat and we send it to the lab, and then they centrifuge it, and they, without using any chemicals, really, just a couple of washes. So they centrifuge it so that we have the differential weight of what the cells weigh, opposed to what the other tissue weighs. And then they get an extract that's only cells and put that in the culture media, and then the cells will grow. So you might get, like I said, 250,000, 300,000 cells. And as an aside, we have more stem cells per cubic inch of fat as we're young, and as we get older, we lose those stem cells. So the best time to bank the cells is yesterday, right? But at the same time, my oldest patient was 93 extracted, and he had a really good result. So we put those in the culture media, and the cells grow, and we make that first group into 200 or 400 million cells, right? And then we take a population of those cells and we watch them all again, and then you put them in another culture media and you freeze these. And you take this little group and you grow that to another 400 million cells. And then you wash them again, you take this little group out, you freeze those, and so you make like 4 generations of cells that you put in the freezer. And then you have what it amounts to. We haven't run out yet. So there's essentially, as far as we know, an infinite supply of your own stem cells. And some patients get a big benefit with just one therapy. So they keep coming back. A lot of patients, unfortunately, don't do all the things that I ask them to do, like fix their environment and their lifestyle, food and exercise. You know, emotional, spiritual detox is so big, just peace and rest and all that. But the stem cells work, so they just keep coming back to get stem cells. Did that answer your question?
There's a question in chat from Laura about whether it's important to reduce inflammation prior to an extraction.
It's a great question, Laura. So it's always best to reduce as much inflammation as soon as possible. That is the truth. Using as many methods as we can, but the extraction I have done in really sick patients, and once you take the cells out of the body, they do really well, because we put them in, right, the environment that they're in is part of the problem, because you have this immune dysregulated inflammatory body for whatever reason, and you take them out and put them in this perfect little dollhouse and grow them, and the cells do really, really well. So I don't typically tell people to delay their extraction any more than we have to, just because we want to get the cells early, as early as possible, because every day that we're living in the world, and particularly the environmental toxins that we're dealing with, we're losing stem cells. Yes. Okay, so the question is, do I recommend banking umbilical cord stem cells for babies? Yes, so now that's a totally different thing. So good question. Cord blood is what they bank for a person. So they take the blood out of the umbilical cord, like I banked my 3 kids' umbilical cord blood and all the stem cells that are in that. And that's a totally separate industry, saving those cells. Those cells can only be used for the person that they're banking for, the donor. You know, they're not supposed to do that. It's only, I mean, I guess there could be some research projects, because we are using adult stem cells in research for other adults. So there may be some research projects. I'm not doing any umbilical cord blood research, but that's a separate industry. The birth tissues, right? The umbilical cord and the amniotic fluid are from moms that donate that tissue to the lab, and then they can be used for anyone. A common question I get from that, which is similar to your question, is how can I use someone else's stem cells in my own body, right? And the answer to that question is these are immune privileged cells and immune privileged tissues. It's very rare, extremely rare, to have any sort of rejection reaction or allergic reaction to the donor cells because of the nature of the immune system of that tissue. Because, you know, it's a miracle. Pregnancy is such a miracle, right? You have another human being living inside another human being with different immune systems, and they're talking to one another. And the mom's immune system is not attacking the baby, and the baby's immune system is not attacking the mom. It's like magic is the best word for it. But part of the reason for that is that is the nature of their immune systems at that time. And those cells are privileged cells. And so I've never had a reaction to any of the thousands of patients. Yes?
Talked a little bit about turmeric and other nutrients that are helpful orally. Did you say more? Are you talking about C, 157? What else?
Yeah, so great question. So she's asking specifically about the stem cell activating factors. So yeah, turmeric, and then there's some ginsengs, and there's a whole list of herbs that I don't have memorized in the product that I'm helping bring to market, which is an oral and a topical product, just plants, herbs, basically. When you use them in a very specific ratio, they're pretty powerful. You asked specifically about BPC 157. So that's a natural peptide that our body makes in our stomach. And I inject that into every person that will let me in their joint, and put people on a little course afterwards. And also use it for other conditions. It's really, really good for the brain. It's good systemically. It 100% works orally. No, it's stable in gastric juice, and it is absorbed, and it does have an effect on the brain and systemic tissues when given orally, as long as it's a quality product. And so I use it liberally. It's a great product. It's not really a stem cell activator, but it's a great biologic product. Did you have a question? Oh, okay. Okay. Any other questions in the chat? Any other questions here? Time is at 7:20. It's almost perfect, actually. So I was going to do an example. I was going to inject my mom's knee, if y'all want to watch that. So actually, let me just tell her story, if that's okay. Yeah. So I think the first time we decided I injected your knee was around 2017. That sounds right? Yes. So knee pain for how long when I first injected you?
It started being uncomfortable. I would say in 4 years before done. But what did it is that I moved the big screen TV from the living room to the bedroom by myself. And then after that, well, you know, it's always rubbing with indian oil, and that just kind of subsided, whatever pain that was coming on. But once I moved that TV by myself, that was it. There was no kidney oil that giving me any relief.
Yeah, so knee pain for several years, that was pretty consistent, and significant degenerative arthritis with lots of changes on the imaging, really bone on bone in a couple of areas, and then aggravated by an acute injury. So probably had some component of soft tissue injury, like a ligament tear. And so we did 3 oxygen ozone peptide injections and 1 biologic injection, which is the stem cell. And then that was over the course. I do those every 3 weeks. So I do oxygen, and 3 weeks later I do oxygen, and then 3 weeks later I do the oxygen and the stem cell. And that gave you relief for how long?
I then on, it didn't, it kind of got back to being able to feel the discomfort, but not affecting me. Because when there was no coming back from moving that TV, I would go to the knee doctor, and he said, you'll have to walk with the cane for the rest of your life. Eventually, he would fix it somewhere down the line. But that was my fate. You know, I never got anywhere near back to that.
Right.
It's just that you just kept on asking me to come to me, and I'm going like, okay, you know, there's still a little bit going on, but I work out, so I don't know. That gal running.
Yeah, yeah.
the-
Oh, right. Oh, yeah. Mom likes to do CrossFit, so she's saying it. The pain pretty much went away almost completely for several years, occasionally bothering you, and then just recently it started. Like if you feel it every now and then.
The workouts for 4 years. Step ropes, box step ups, squats.
Yeah, exactly.
I take a little senior discount to be on that, but you know, it's still the workout. So
Yeah. So the combination of oxygen, peptides, and stem cells has been very effective, and in almost every one of my patients, with only a couple of exceptions, which I knew when they refuse to change their life or their lifestyle or their food or something, or deal with a known inflammatory trigger, it can really help. Even better than $200,000 worth of stem cells, which is why I don't do that. So that does bring up the cost I need to mention. So the oxygen injections are $500, and that is per injection. The stem cell products range from $2,200 to up to as much as you want to pay. So, I mean, I've done stem cell therapy for $50,000 per dose, right? If you're doing 800 million stem cells. So that's why I always, because I'm in this for good, not for the money. I mean, this is to try to just change the world of medicine and get people to heal. So I am always talking about that comprehensive approach. What can we do simply? What can you do with your food, with your home, with your life that will make this better and get the magical healing machine to do what it's created? So, but very effective when you do all of it. Very, very effective. So why don't you come up and we'll, yes. Yes, so there have been a few case reports of macular degeneration getting better, but I've gotten, ozone, IV ozone, and fixing nutrients and dealing with the underlying cause of the inflammatory eye disease or the degenerative eye disease, right? So mold toxicity causes a lot of retina problems. Mold is terrible for any fat in our body, and our retina is all fat. Our brain and our nerves, all fat. And so any fat soluble toxin will just destroy it. Mercury, the reason I'm a doctor, was mercury toxicity. So we have to address the underlying root. Now, stem cells can be helpful, particularly with ozone, if done wisely. But the eye can't heal without retinols, right? The right kind of vitamin A. You can't eat enough carrots to get retinol. You got to have fish liver or beef liver and egg yolks and butter. You have to have real retinol. You have to have appropriate levels of zinc. You have to have like all the essential fats like EPA, DHA, lots of DHA. Like you have to have these things so that the eye can heal.
Retinal what?
Mold toxicity.
Retinal what? What was the other word? Retina something.
It causes the retina to be inflamed. It causes blindness. Mold toxicity will cause blindness. Okay, come on up. We're going to take a break on Zoom for a second. for y'all that want to watch. You're welcome to come up.
Okay, so ultrasound is key for some patients. We don't use it on everybody, but it depends on what we're doing. I only have music background.
Waiting for you to sing.
Oh, geez. So we clean the knee off real good. And I've done, I mean, oh golly, I don't know how many thousands of these. We used to sterile glove and sterile gown and drape everything over. And now you don't need to do all that. As long as you use sterile needle and good technique. If I remember right, you're pretty good with these, right? This doesn't even bother you? Yeah. Except the one time?
I go into my Lamaze breathing. No, it's not.
Okay, so I will show you what okay, so this is the knee joint right here. And this is supposed to be nice and flat and round. It's not supposed to look like two mountain peaks, right? So this is what a degenerative knee looks like. There's no space in there. You can see the meniscus is this little pizza shaped wedge right there. See how when I do that, it goes down. And when I go back to neutral, it pooches out. You'll see that? So this is bone on bone right here. There's no cartilage that I see. There's fluid around here. But again, how much pain do you have?
Hardly any.
Hardly any. So, this is a little bit of a different approach compared to some of the surgical approaches. I'm not a surgeon. I don't do joint replacement. I don't do surgery. So my goal is function and quality of life. So if I can get somebody that has no pain and can do everything they want to do, that's a huge win. I don't have to fix the way it looks, right? So what we did was probably get you a little layer of cartilage that lasted for now 5 years or more. We can't remember exactly because it's been so long. Okay, so just for bearings, I mean, I'm trying to see if I can turn on your left hip the other way. There you go. And just relax the scene. So what I'm looking for is, this is skin. This is the quadriceps tendon. This is the kneecap. You can't see through bone, which is why this is all black. Bone is right there, that white strip. And then I can see her joint space, which is right here, this black line, that's joint space. So a lot of times with ultrasound guided injections, we'll do right here and get the needle in the joint space there. Where is your pain mostly? Here?
Inside, yeah.
Yeah, right in there. Okay, so for her, I'm gonna do a different, I'm not gonna use the ultrasound. I'm going to do a different approach here. I don't have anything sharp yet. I'm just gonna mark her skin. So this is the old landmark approach where I don't use the ultrasound. I just know where the needle tip is going. And that's because most of her pain is over there on that side. I want to get the PEP. So I'm using BPC in this injection, BPC and oxygen, ozone, which helps stimulate. So the ozone helps stimulate the stem cells, and the BPC helps the collagen fibers lay down straight and thick. You can go ahead and pull it like 40 and at 40. So we do a little bit of numbing medicine and the I did forgot my hemostats. We go grab them out of M6 in that jar. I didn't prep. That's okay. So this is oxygen ozone mixture. So ozone is just energized oxygen. So you put a little lightning bolt through O2 and it becomes a mixture of O2 and O3. And what that does is oxygen is a really powerful antimicrobial. So it, the other thing is that you don't want blood vessels in your joint. If you had blood vessels in your joint would fill up with blood. And that's very painful. So arthritis is routinely calling for oxygen in the joint, right? Because it's starved of oxygen. And blood vessels will grow into the joint to try to heal the joint, but it causes more than it's helping, causes more trouble. And so you put oxygen in there, that halts that process and it calms down the inflammation dramatically. It works really well. Okay, so I know y'all can't see this going in, but just you're going to feel a little needle poke. You're going to hand me the hemostats and that ozone little poke. So that's it right there. That's the hard part of the injection. I have the needle tip right where I want it, inside the knee joint. You feel anything there?
Not right now.
Great. So that's the peptide. And then we put the oxygen in. Feel pressure?
Slide.
Okay, great. And that's it. And I just need a 2x2 in the pancake. How was that?
Not bad at all.
And I didn't even pay her.
Thank you, smiling.
No, it really wasn't bad at all.
Yeah, most people say, you know, the injection is they hardly feel it, but pain is, you know, perceived in our brain. And so I do the same thing every time. And so you can have some people that really feel a lot of pain. The men are generally worse than the women. So I've had a couple of guys that I could swear were going to punch me in the face.
They never had chow.
That's exactly. Okay, and then this is the fun part because it almost always, I don't need it just yet. So if y'all listen real close, do y'all hear that? So that squishy sound is normal. That's the oxygen and the fluid mixing around in the joint. And that just means that I put the oxygen and the fluid exactly where I want it to, because there's a joint capsule and it should stay in there. So in really difficult joints, sometimes you can't get the needle tip exactly where you want. And so it makes it nice, because if I don't hear that sound, it means I need to do the injection, which has happened a couple of times in January. But it's fine. It still works. Now, the other thing that I do, yeah, actually it helps better. So in patients that are real difficult, I put a lot more oxygen, ozone, peptide on both sides of the joint. And there's a really interesting, you know, the brain body connection, because our brain controls everything. And so some of my real resistant patients, they didn't seem to be getting better. They were doing everything right. I thought maybe I need to activate that. And so I put some ozone in the skin where it's real tender. It causes a lot more pain. There's like a little stinging. And then they got better. And it's like waking up the brain to the place that needs healing.
Do you ever find that there is migration of stem cells and BPC that to
So, yeah,
other places?
That definitely happens. We still don't have that worked out, like why that happens in some cases and not others, but it definitely does. And in my experience, ozone is one of the best ways to do that, because it's a really powerful signaling molecule that our body knows really well. Okay.
How long will it take for all that to be absorbed?
So
How long is it going to sound squishy?
So between a few hours and a couple of days, normally several hours, 3 to 6 hours. But every once in a while, it lasts for longer.
There a reason when I'm like, it's evening. He's eventually gonna go to bed. Should her joint continue to work through it? Is it better to do this type of thing like in the morning while you may go more active? Will it make it?
No, once I put the ozone in there, now that work is going to be done no matter what for the next 3 to 4 weeks. It works over about 3 to 4 weeks. And so usually I'll put people on some oral BPC, a couple of other peptides, and injectable if they can afford it. Anything injectable is a little bit more expensive and it's more problematic. So needles and alcohol swabbing. But the oral works very well. So sometimes it feels so good. So I've had a couple of patients that are like, my joint hasn't felt. My brother actually, when I was first researching all this, he's like, I haven't felt this good in 20 years. And he went and played basketball for a whole day. and like sort of injured himself. So it's like, just hold on, just do regular activities for a few weeks. Let's see how it goes. Yeah, exactly.
So when would you start feeling relief of pain or discomfort? Because you
So
said-
why don't you stand up, and I don't know if it was hurting before.
No, it just depends on what the workout is as to when it's.
So what normally would make it right
Um,
now? If you sat down or low, or
the squats.
yes.
I hate to squat.
So like just just hold on to my hand and do a squat. And you know,
This is what that makes it.
say, I'm not an old woman.
19 of those 5 times it was in the workout.
So would that normally hurt? Do it again?
No, it doesn't hurt. It's like later,
Okay.
you know, I get home and it's like, I think I need to rub it.
Yeah. So normally I'll know, because I use a tiny little bit of numbing medicine, if I got the oxygen and the peptide at the point that it needs to get. And so right away they feel better. And if they don't feel better, then that means that I need to do something else. So it's a little bit diagnostic. So for instance, I just did a guy last week with shoulder pain in the front, but I thought it was his joint inside the joint. We don't do really shoulder injections from the front, we do them from the back. So I injected his shoulder joint from the back, and the pain in the front went away. So that verified that this is inside the joint, right? So most people feel better before they get off the tape. Every once in a while, it takes a little while. If they're not better right away, then not always, but often I'll do another injection just to make sure that I got it right. Because getting the ozone in the right place is what tells the body heal this. That makes sense?
Yeah.
Any other questions?
Laura has one in the chat. What's the time frame between extraction and re-injection?
So great question. The time frame between fat extraction for stem cells and re-injection is at least 3 weeks. It takes some clients a little longer. So the patients that are sicker, that have more chronic or complex medical issues, or they're older, they take a little longer to grow. So it can be 6 or 8 weeks.
Next question is, would you change the injection site to the chest or lung area if the complaint is asthma?
Okay, great question. So, somebody else asked about asthma, or maybe it was her. For lung issues, we do IV treatment, because when I put something in somebody's vein, the very first place that blood goes is to the lungs. So I actually had one amazing recovery. I don't have a research department, but he had pulmonary fibrosis, which doesn't get better. There's never been a case report of it getting better, and he got better with stem cells. So he couldn't stand up. He had to use oxygen at rest, just to not be short of breath. And if he stood up, he would desaturate and get short of breath and have to sit back down. And I got him running 3 miles with bunches. We did bunches of exosomes and peptides and IV stem cells, and his lungs healed. So because it goes right there once you put it in the IV. Yeah. So and I haven't treated a bunch of ALS patients, but I have a colleague in Florida who has gotten some recoveries. Again, ALS though, if you catch it early and you figure out why, that's the most important thing. But I'll still use the exosomes and the stem cells.
What about cancer?
So that's a great question. So the data is mixed on cancer, because some of the factors in stem cells are growth factors, which promote growth. And so there's some people that say that stem cells are contraindicated in cancer patients, which is not true. You just have to be thoughtful. So there are some cases where if it's primarily like an inflammatory cancer, if you calm down inflammation.
Like my mom has.
Yeah, so
At some point. Who cares if there's a chance?
right, exactly. Well, so the most important thing in that is just that somebody's thinking about it. And it wouldn't be contraindicated in my view, it just we would have to be cautious.
Well, nervous system issues, Parkinson's or something like that.
Really good benefits in Parkinson's. So, we're seeing in the broad research about 85% of patients get some benefit. So the 15% that don't, sometimes we know why that is, right? So the person that refuses to do something that we know is harming them. And sometimes we don't. And then sometimes it's a dose question. But yeah, Parkinson's, MS, really good results in Parkinson's. And dementia. Maybe 50% of patients get better. We can get that number better if we address the underlying cause with the stem cell.
Two separate questions or two separate diagnoses. One person asked about cataracts or early stage cataracts, and then someone asked about autism.
Okay, so cataracts, I don't know of a benefit for cataracts. I haven't seen any. That doesn't mean it's not out there. I just haven't seen a patient or a paper where the stem cells helped with cataracts. For autism, yes, there are some cases where it can help. But again, autism, particularly if you catch it early, if you just think about why it is. So autism is a complex disease with multiple triggers. And you really have to be thoughtful, but stem cells can help with autistic kids.
All the questions in the group chat so far.
All right.
What about muscle tears, abdominal muscle tears?
Yes.
Respond?
Yeah, ozone, peptides, and stem cells would, it depends on how bad the tear is. But yes, potentially. I mean, if it's a small tear, if it's a big tear, that can be tough. Because it's not something you can splint, right? The tear edges would have to be close enough together where the tissue would grow together. So have to be small enough and not displaced.
For osteoporosis?
Yeah, so definitely osteoporosis. Now, osteoporosis, though, I've gotten lots of patients with osteoporosis back because you deal with the cause. So you have to do weight bearing exercise. You have to have adequate stomach acid. You have to have adequate collagen production. You have to have minerals and not just calcium. Most people are over calcium and under other minerals. They're low in other minerals. And you have to have enough vitamin K2. So you can't put minerals in bone without stomach acid, K2, and weight-bearing exercise. So women all need to be doing weight-bearing exercise. Maybe not as crazy as CrossFit, but rubber bands, vibration plates, some sort of weight-bearing to stimulate the bone to grow, and then you provide the food and the bones will grow. But stem cells can help with that.
And I'm going to use a lot of language like better and helps. How are you measuring that improvement? How are you measuring?
Yeah.
Because you haven't ever said cure, and I appreciate that.
Yeah.
So how are you measuring better?
Yeah, so most of these are on surveys. So the SF36 survey, it's a real standardized survey about quality of life and pain and function and mobility and all that. So it is very subjective. And then sometimes there's objective measures. So for instance, pulmonary fibrosis. If you're hypoxic at rest, right, you require 8 liters of oxygen just to be alive. And then you now don't have any oxygen.
Running 3 miles.
That's a 43-year-old.
Yeah.
So, go from that to not needing oxygen to run 3 miles. That's an objective thing.
But this is also not just stem cells, it's also changing things.
Yeah.
there's not one pill to cure it all, nor one shot to cure it all.
No,
It takes many, many things.
it's, you don't have to get it all right. You just have to be thoughtful, right? And, sometimes we don't have to take out corn. Right? I mean, I love corn. And sometimes we do. Corn is delicious, there's no question about that. And we do enough so that you get the result that you, and if your symptoms are relieved, your life is great and you get to eat corn chips, all the better.
We're in San Antonio.
Right.
Okay, so I've got a question about that.
Okay.
So it's like going on a diet, and then you've got the one day that it's like, okay, you're gonna go off it, and then you go back on. And it seems like that's what I do with corn.
Oh, okay.
So for the most part, it's like Derek's over here going like, the corn. But I go to somebody's house, they have corn, it's like, okay, I'm gonna have the corn.
And that's a great way to do it. Rotational eating for potentially problematic foods is a really good way to have a good body. So if you eat something every day, it should be pretty healthy. But rotational eating is very wise. And corn chips are delicious.
Yes.
Just have them
I know.
cooked correctly.
Yeah. And then the
Okay.
tacos,
It's
corn tortillas.
But is there such a thing as non-GMO corn?
Mhm.
Okay, there is. Okay.
I'm gonna be growing corn, I'm convinced. I'm gonna have good corn eventually. See what happens. Hmm? Yeah, right.
As well as my hip, my knees, I have to say the hip pain that you gave me shots for.
Oh, yeah.
I couldn't sleep. I'd get up, there was a lot of rubbing going on. That would just last for a little bit, and then it was terrible. And I can sleep, and I don't have that hip pain. That was dramatic for me.
Right.
Wow.
A
Yeah,
lot more
the
than-
same thing. Same recipe.
So here's one. As such,
Oh, yeah. Mm-hmm. It works great.
the same formula
Same formula.
with SI, sacroiliac.
This big joint right here.
Oh, yeah, and,
It sort of holds your whole body up.
and women, they kind of pop in and out and cause a lot of pain.
Yeah, now that's a more uncomfortable injection. You have to go through a big, thick ligament, but it does help. It works the same. Well, so I have a big cryo unit. That's what I prefer, that because it's easier. It's drier. I just get in the morning and get out. Whereas a cold plunge is like bed and stuff, but they're equally effective. There's probably benefits that haven't been really delineated for both differently, but they're both great.
Like to offer the consult.
Oh, yeah. So if you guys, since you came tonight, we can do a 15-minute consult. I won't charge you to talk about these things personally. So how this type of therapy might benefit you. It's a focused exam. So I'm not going to review your history or your old records or anything like that. Just how might this help you for 15 minutes or so. We can do that in person here, and that's no charge, because now you've got the whole, that benefits me because you understand the way I think, and it benefits you because you know the process, and I don't have to explain.
Cold therapy, how often should someone do it?
Cold therapy?
Yeah.
So it depends. I would say 2-3 times a week for maintenance is good. Once a week is probably enough for maintenance. For acute issues or severe issues, I sometimes have people do it twice a day. So it makes a big difference. It can make a big difference. It can really turn off inflammation pretty quick and inflammatory pain. If you do it once daily for many days in a row, it can really turn off.
Thank you.
All right. Thanks, everybody, for coming by. Thank you.